Respiratory rate. Respiratory rate, RR, also known as breathing rate, is a vital sign that provides crucial information about a person's physiological state. Definition: the respiratory rate is defined as the number of breaths a person takes per minute. A breath consists of one inhalation, chest rising, and one exhalation, chest falling. This rate is controlled by the respiratory center in the brain and is a key indicator of how well the body is delivering oxygen to its tissues and removing carbon dioxide. Technique to measure. Measuring respiratory rate is typically done when a person is at rest to ensure accuracy. The most common and simple technique involves 1. Patient position. Have the person sit quietly or lie down in a relaxed position. It's often recommended to measure without the patient being aware, as conscious awareness of breathing can alter the rate. 2. Observation. Observe the rise and fall of the chest or abdomen. 3. Counting. Count the number of full breaths, one inhale and one exhale, for a full minute. While shorter periods, e.g., 15 or 30 seconds multiplied by 4 or 2, respectively, are sometimes used, counting for a full minute generally provides more accurate results, especially with slower rates. 4. Note characteristics. In addition to the rate, it's important to observe the depth, shallow, normal, deep, and rhythm, regular, irregular, of breathing, as well as any signs of difficulty, e.g., use of accessory muscles, wheezing, gasping. Automated methods. In clinical settings, more advanced methods are used, including thoracic impedance pneumography. Measures changes in electrical impedance across the chest as the lungs fill and empty. Capnography measures the concentration of carbon dioxide in exhaled breath. Wearable devices. Some devices can continuously monitor respiratory rate using various sensors. Normal range. Normal respiratory rates vary significantly with age. It's crucial to consider the age of the individual when assessing their respiratory rate. Newborns, birth to 1 month, 30 to 60 breaths per minute. Infants, 1 to 12 months, 26 to 60 breaths per minute, or 30 to 60. Toddlers, 1 to 3 years, 24 to 40 breaths per minute. Preschoolers, 3 to 5 years, 22 to 34 breaths per minute. School-age children, 6 to 12 years, 18 to 30 breaths per minute. Adolescents, 13 to 17 years, 12 to 16 or 12 to 22 breaths per minute. Adults, 18 plus years, 12 to 20 breaths per minute. Some sources say 12 to 18 or 10 to 20. Clinical significance. Respiratory rate is a highly sensitive vital sign that can indicate a variety of physiological conditions and stressors. Abnormal respiratory rates can be a critical early indicator of patient deterioration or underlying medical problems. Increased respiratory rate, tachypnea, and elevated respiratory rate can be a sign of the body trying to compensate for an imbalance or increased demand. Common causes include fever. The body increases breathing to help release heat. Infections, e.g., pneumonia. The lungs may be less efficient at gas exchange, leading to faster breathing to compensate for low oxygen levels. Asthma, COPD, other lung conditions. Narrowed airways make breathing harder, leading to faster, often shallower, breaths. Heart conditions, e.g., heart failure. The heart may not be pumping blood efficiently, leading to reduced oxygen delivery and increased breathing to compensate. Anxiety or panic attacks. Hyperventilation is a common symptom due to the fight or flight response. Dehydration. Severe dehydration can lead to increased breathing as the body attempts to compensate for fluid imbalance. Metabolic acidosis. The body attempts to blow off carbon dioxide, an acid, to correct the acid-base balance. Pain. Acute pain can increase breathing rate. Stimulants. Certain medications or substances can increase respiratory drive. Early warning sign of critical illness. Tachypnea is often the most significant predictor of critical illness, including cardiac arrest, sometimes hours before other vital signs show significant changes. Decreased respiratory rate, bradypnea. A slowed respiratory rate can indicate depression of the central nervous system or metabolic issues. Common causes include medication overdose, especially narcotics and sedatives, which depress the respiratory drive. Brain injury or stroke. Damage to the brainstem, which controls breathing, can lead to slow or irregular breathing. Hypothermia. Severely low body temperature can slow down metabolic processes, including breathing. Alcohol intoxication. Alcohol is a central nervous system depressant. Metabolic alkalosis. The body tries to retain carbon dioxide to correct the acid-base balance. Sleep apnea. Episodes of shallow or paused breathing during sleep. In summary, monitoring respiratory rate, along with other vital signs like temperature, pulse, and blood pressure, is essential for detecting and managing various health conditions, from minor illnesses to life-threatening emergencies. Thank you.